People with learning disabilities are now living longer. However, one of the negative consequences of this is that they are now more prone to diseases associated with the ageing process, like cancer for example. And it was a cancer care organisation, the Marie Curie Hospice, who, when they were working with the Royal Liverpool University Hospital, devised what has become known as the Liverpool Care Pathway. This was designed to provide a dignified end-of-life strategy for dying patients. But the Liverpool Care Pathway has attracted some bad headlines recently. Apparently, its original purpose has been hijacked by health economists who are now conflating good quality care with meeting targets. The suggestion is that for some patients at least, the care pathway has become a death sentence rather than a palliative resource. Of course, death comes to us all and we don't always get to choose our own exit strategy. So we could go out with a bang, in which case no amount of care planning will ease our process from this world to whatever comes next. Or we may go out with a whimper at the end of a long degenerative disease process. In these circumstances, what then is the role of the learning disability nurse in providing care for the person with a learning disability if they go into hospital in a terminal condition? It could be that we combine the care plan along with something like the traffic light system to ensure that we advocate for the needs of the individual and for their relatives and carers. This would offer some protection to their final wishes. And speaking of endings, my own GP has recently diagnosed me with terminal writer's block. I'm afraid there's no cure. All I can say is the editorial staff have been great, so thanks to Colin and Duncan. But somebody else can have my bed now. These are my last words. Here lies one whose name was writ in water.